Aging and lifestyle. Aging of the skin is not absolutely outside influences. It's some of the things we do, such as smoking or using tobacco. Nicotine in tobacco causes contraction and weakening of the blood vessels and small capillaries, and that's how our skin is fed. So we mess that up, no longer able to grow and reproduce as it should. The use of illegal drugs affects the skin as much as smoking. Some drugs have been shown to interfere with the body's intake of oxygen, thus affecting healthy cell growth. Some drugs can even aggravate serious skin conditions such as acne. The use of alcohol has an opposite yet equally damaging effect on the skin. Heavy or excessive intake of alcohol overdilates the blood vessels and capillaries. This constant overdilation and weakening of the fragile capillary walls cause them to burst. That's why we often see the little red spider webby lines on somebody's face that's done a lot of drinking. It usually comes right across the nose and cheek area. Both smoking and drinking contribute to aging process on their own, but the combination can be devastating to the tissues. And I might add about smoking and drinking in combination is cancer has been found to be worse in soft tissues of the person that smokes and drinks together and excessively. You understand what I'm saying? If you smoke, you may get soft cell skin cancer. If you drink, you may get it, but the combination of the two really makes it bad. All right, what we've all been waiting for. Disorders of the skin. You can't wait for this, can you? Like any other organ of the body, the skin is susceptible to a variety of diseases, disorders, and ailments. We're going to often see skin and scalp disorders. We need to learn to recognize them. We're not going to diagnose skin problems. But we need to recognize, is this dangerous to be working on? Is this something we can help? Is this something she's got to see a doctor about? Some skin and scalp disorders can be treated in cooperation with and under the supervision of a physician. Medicinal preparations available only by prescription must be applied in accordance with the physician's directions. If the client has a skin condition that you do not recognize as a simple disorder, make sure you tell them to go to the physician. Make sure you don't be touching it either. It's very important that a beauty salon does not serve a client who is suffering from an inflamed skin disorder, whether it's infectious or not. We don't want to work on someone with an inflamed skin disorder because of doing more damage to it. It's already sore and red and contains pus. The cosmetologist must be able to recognize conditions and sensitively suggest that proper measures be taken to prevent more serious consequences. So the health of us as well as the health of clients is safeguarded. We're going to talk about a number of important terms relating to the skin, scalp, and hair disorders that you should be familiar with. First of which is a lesion. Lesion is simply an injury or damage that changes the structure of tissues or organs. Three types of lesions we're concerned with: primary, secondary, and tertiary. We're concerned with primary and secondary lesions only. If we're familiar with these principal skin lesions, you will be able to distinguish between conditions that may or may not be treated in a beauty salon. Our primary lesions are bulla, a large blister containing a watery fluid similar to a vesicule but larger. Would we be concerned with touching that or working with it? It in and of itself may not be a problem to us, but if we were to burst it, it could become we got body fluids now. A cyst. It's a closed, abnormally developed sac containing fluid, semi-fluid, or morbid matter. It can be above or below the skin. What is morbid matter? Hard? Nasty. It certainly to us would be nasty. Wouldn't it be like morbid, like the dead skin cells that have accumulated there, and maybe our sebum is holding it there, or we just have it exfoliated? That's what we were talking about yesterday, the importance of exfoliating. A lot of people know the importance of cleansing, But cleansing does not do it all. Doesn't take it all off, especially if we've got a little bit of oiliness we need to exfoliate. Would we be concerned with the cyst? Somewhat, but we're not going to be overly concerned with it. We'd be careful not to open it. And if we were going to do something with it we thought we might, we want to glove up. But we're not going to be overly concerned with it. Macule. It's a spot of discoloration on the skin such as freckles. Macules are neither raised nor sunken. We concerned about that? Nah, we'll clean over them all day long, put makeup on them, it don't matter to us. Papule. It's a pimple, a small circumscribed elevation on the skin that contains no fluid, but it may develop pus. We concerned with it? If it's got pus in it, we're concerned with it, but actually during the facial, we're trying to cleanse this skin and exfoliate this skin and get rid of these papules. Pustule is an inflamed pimple containing pus. That throws up a red flag, says put on some gloves. You can still work on them, but put on some gloves. Just, be careful around that area. Tubercle is an abnormal rounded solid lump above, within, or under the skin. It's larger than a papule. Does that bother us? Concerned about it? No, we may not like it, but it's not going to bother us. Tumor is a swelling or an abnormal cell mass resulting from excessive multiplication of cells, varying in size, shape, and color. Nodules may also be referred to as tumors, but are smaller. We concerned with them? No. Vesicule. It's a small blister or sac containing clear fluid lying within or just beneath the epidermis. Poison ivy and poison oak, for example, produce vesicles. We concerned about them? Yes, we are, because that fluid's going to come out, and we don't want any part of it. Wheal. It's an itchy, swollen lesion that lasts only a few hours, caused by a blow, the bite of an insect, or the sting of a nettle, such as hives and mosquito bites. We concerned with it? Our tendency is to say no. But have you ever been bitten by something and a drop of blood come to the surface from it? We concerned about blood. Remember, we don't want to be handling anybody's blood. Our secondary lesions are those that develop in the later stages of disease. These include a crust, which is dead cells that form over a wound or blemish while it is healing. It's an accumulation of sebum and pus, sometimes mixed with epidermal material. An example is the scab on a sore. We want to be handling that. No, we don't. Even if there's no pus present, there's all kind of stuff mixed in with that scab. And besides that, we don't want to re-injure or pull that scab loose. Scoriation is a skin sore or abrasion produced by scratching or scraping. We concerned about it? We're not concerned about catching something from it. We simply don't want to handle it because it may have blood or body fluids coming out of it. Fissure. It's a crack in the skin that penetrates the dermis, such as chapped hands or chapped lips. And again, we're not overly concerned with that, but if the skin is cracked, then we may have body fluids escaping. Keloid. It's a thick scar resulting from excessive growth of fibrous tissue. We concerned about it? No. Scale is any thin plate of epidermal flakes, dry or oily. An example is abnormal or excessive dandruff. We concerned with it? We are concerned with it. Dandruff is a contagious disorder. True dandruff is. Not only can we catch it, we can get it on our equipment and spread it from client to client. Scar or cicatrix. It's a light-colored, slightly raised mark on the skin formed by an injury or lesion of the skin that has healed. We concerned with it? Not a bit. Ulcer is an open lesion on the skin or mucous membrane of the body accompanied by pus and loss of skin depth. We concerned? Red flag goes up there. There's pus. Disorders of the sebaceous or oil glands. Several common disorders of the sebaceous or oil glands that we're able to understand and identify. Some of these we can do something about, because remember now we're talking about disorders. A comedones or blackhead is a worm-like mass of hardened sebum in a hair follicle. Comedones appear most frequently on the face, especially the forehead and nose. When the hair follicle is filled with an excess of oil from the sebaceous glands, a blackhead forms and creates a blockage at the mouth of the follicle. Blackheads should be removed under sterile conditions using proper extraction procedures. Should the condition become severe, medical attention is necessary.